Good afternoon, everyone. Thanks for coming along to the On the Couch session this afternoon. This afternoon we're here to hear from Andrew. Andrew has alcohol brain-related damage. Andrew's going to talk to us about the support that he gets from the team that's wrapped around him and the local health and social care team. Really, Andrew, the team help you live independently as possible, so I suppose maybe it'd be useful just to give us a wee bit of background, how you got to that stage and what support the team give to you. So over to you.
I started drinking heavy when I was about 19-year-old, and my mother passed away. That was really the first of me using alcohol as a crutch, basically.
Right.
I had a background in civil engineering. That's what I'd done. I don't know what it was, I just started drinking, and one drink led to another, and before I know it, 20 years had passed, and I'm like, whoa, what's happened?
Yeah.
And that's basically been it. And then these guys came on the scene 4 months ago,
Right.
and I was living in an absolute pigsty. My house was a mess, everything was a mess, I had bills piled up that high, and all I was doing was just drinking. And I thought I was going to die, basically. I knew I was. The house, everything was a mess. My health was terrible. And then these two came on the scene, two angels. And wow, how things have changed in 4 months. It's night and day, the difference.
What difference do you think these two have made to you?
Helped me cope, taking care of all my needs, getting in contact with the council and other Penumbra Mental Health, and just basically getting everything together so it's a lot easier for me to cope with. Because before, I didn't know where to start.
Yeah.
I didn't have a clue where to start, how to fix things. And they just they lean on and help me through it.
So do you think having that support's made a massive difference?
Oh, definitely. Well, I've tried to stop before, and I never got nowhere. And now they come out whenever I need them. I say I can phone Sharon any time of the day, all night, and she's there. It's good. It's been brilliant. I say I'm 4 months sober, so.
Well, congratulations. You obviously have tried to stop before, and the girls have came on the scene. Obviously, they're providing an integrated level of support to you. What's the difference in terms of the support that they're giving you now, in terms of the joined upness of that, compared to? Is it just that there were different agencies working?
Well, with these guys, they got all the agencies involved together, so they all speak to each other, and it's they're there all the time. Any day of the week I need them, and they come out 2 or 3 days a week, and I've got other people that come out to see me. So there's always someone. If I feel like I'm needing a drink or feeling a little bit low, there's always somebody to pick me back up and say, right, come on, you could do it.
I made the mistake of saying you were living in supported accommodation, but you're now in a council house.
Yeah.
How do you feel about that? I mean, it must be a massive step for you to go from one to the other.
Well, 4 months ago, when they first went to see me, I thought I was going to lose my house.
Right.
The bills were piling up, and I was ignoring the post. I was just ripping it up and putting it in the bucket, or ignoring it completely. And when they first come, I remember someone shouting to my letter about, Andrew, we're here to help you. And I'm like, get away, I'm no in. You know what I mean? I just couldn't open the door. The house was an absolute pigsty. There was bottles, there was like 150 bottles of wine.
Right.
But just sitting in my house. It was like it was a nightmare. There was no existence at all. It was terrible. And then I just thought, right, I lay down and I just thought, I'm going to die here. This is it. I was ill, I was being sick every day. Every morning I was waking up, I was sick. Every night I was sick. It was horrible. And I was down to 53 kilograms, so was that 9 stone 7 or something? Maybe less than that. And I put on 2 stones just to come to see me. That's how bad it was. And I'm still really skinny, but if you'd seen me before,
Wow, you came a long way. Eh?
Just now my memory. And being out and about as well, I'm really nervous around people. Because before, drink was when I had a drink in me all, life and sober, the party.
Yeah.
Now being sober, sort of new experience.
Right. Just learning how to do things.
Basically, yeah.
And experience things in a different way. So I suppose, like, looking at the future, when you've got the support team, what's your ultimate goal?
Get back working.
Get back working.
Definitely.
turn to your support team, and I suppose hearing it from the different side of the coin, obviously Andrew's spoken really highly of the pair of yous. What was it like coming in to help Andrew?
Well, the alcohol-related brain damage team it's a nurse-led service, and it was on the background of there are a lot of patients that were going under the radar and not accessing GPs, and if services were involved, there was very little engagement with services, so there was no improvement in mental health and physical health. And so our service really is to go in and work with people, even if they're still drinking, to try and improve their quality of life. But actually, by engaging them in doing that, it just had a really positive effect on the drinking, so that reduced naturally anyway. And one of our philosophies is that if you show somebody that you care about them, actually they do start caring about themselves. It's proven to do that, and you do now. Andrew had no contact with his family because of his drinking. He'd lost his finances, his health, his family, his employment, and slowly those are all coming back into play. But we do take it one step at a time with him, really. At the moment, we're just trying to introduce some voluntary work, which he would never have thought of doing, this time last year. He would never have been physically or mentally capable to do that. But it's come a long way. But I suppose from a service point of view, what does prove is consistency, being consistently available for the patient to be able to contact us regardless of what's going on, whether it's to tell us some good news or to tell us some bad news. It's that consistency in keeping that person engaged with the service. With the alcohol-related brain damage team for Fife is a case management service, so the patients that we do see have got complex needs and a lot of services involved, and there are problems sometimes keeping the consistency and the engagement going with these other services. So one of our roles is to pull all that together and to educate the other services about alcohol-related brain damage and why somebody might act in one way or react in one way or behave in a certain way, and it might be due to their cognitive impairment. So we have a holistic approach when we take on any patient to our service. So we look at the mental health, the physical health, the housing, their environment that they're living in, what support services have been involved in the past and currently involved, and just pulling all that together really, so that the patient ends up with a better quality of life ultimately. And that's our absolute goal really. Yeah.